And we are ready to go. Alrighty. How we doing, people? I'm just getting everything pulled up here. There we go. Boom and boom. Okay, doke. Got YouTube, got TikTok. How you guys doing? Hope everybody is doing well. This stinking thing happened again. I've been trying to find where the chats are at. Oh, that is not what I wanted at all. I ran into the same stinking issue yesterday. Hold on. Nas popping into the chat. What's going on, Nas? How's everybody doing? I had a pretty good old day here. Just cranking away on getting this office up and running. So that's been kind of cool. Doing a lot of back end of things like setting up insurances and doing all this extra stuff. Is this what I have to go to? I don't know why I can't pull up chats. What on earth? Oh, that's why. I know why. Okay, one more second, jeez. You can't see him, that's why. There we go. Holy crap. Alright, there you all are. Now saying hello. But yeah, doing more of the back end of things in terms of insurances and getting this x-ray to get everything going. So that we can install this darn x-ray and get our permits and start working on everything. So, busy with midterm exams. Nice. How's everything going? Well, spent a good amount of time outside. I've been doing more outside workouts, which is very nice. Getting the fresh air in, even if it's cold. I think we do not spend enough time outside, whether it be warm weather or not. Everybody should be going outside more, to be totally honest with you. I know it's cold, but still, it is good for you to get basically a positive stressor onto the system by getting good exposure outside, even if it's just for a few minutes. Even when it's cold, you can benefit more from that. But aside from some outdoor activities, definitely a whole lot of back end things today. Very administration heavy for getting this office prepared and rolling, but we got to do the daily live, as always promised for you folks. Gets dark at 4:30 now. I know. How about that? The daylight savings kicking my ass too. It's terrible. It's awful. But we're putting up with it. So, but yes, daylight savings friggin' sucks, huh? But we got some of our regulars coming in. A lot of familiar names. I would say faces, but not really a face thing. Sweet Thang says, why am I having bad neck pain and bad headaches every single day? There can be things that go on physically. So whether it be, okay, I thought she asked another question. But, oh my freaking notifications. Anyways, with neck pain, there can be things that structurally occur. So you can have reversal of the cervical curve, which is never fun. I definitely want people doing more rehab specific things based off films. So I could bet your bottom that your neck's starting to straighten out, because it's happening to basically anybody that has a cell phone at this point. Even if you don't, it's still happening. And it puts stress on the entire system, because you can't really replace your brain, right? That being the most important system in the body is your central nervous system. It controls everything else. You can get a heart transplant, you can get a lung transplant. Can't do that with the brain. So getting stress off the nervous system is huge, whether you do a prolordotic exercise or I'd be curious if there's, any hypermobile segments that can be possible too, but most of the time what you're going to see is a lack of mobility. So hypomobility and just getting good motion in there. There's some good massagers that you can get in things too, just to help the muscles calm down and things, but there can be things that go on chemically. lack of electrolytes, lack of nutritional things, different deficiencies that can occur, or you could be toxic in a couple elements too. Last pillar being the mental stress, huge there. Mental stress can definitely do a number on you and not just lead to neck pain, but back pain and all sorts of things. So why am I doing the chats up there? I have a whole thing right here. Okay. In how much detail do you learn the muscular system in school? Lucky for me, I kind of learned it all twice. So I had kinesiology and obviously all the baseline muscular anatomy, insertion and origin points, nerve actions, arterial things. But yeah, undergrad I had that one time, and then in grad school I had it once over again, which was really nice because I just breezed through the class. So that was great. There was a lot of overlap because athletic training was my undergrad. So, but yeah, in grad school it was like a piece of cake. It goes quick though in grad school, so the quality of that learning is very little. Have you dealt with IIH patients before? You'd have to spell that all out for me. I'm not sure what that is. What's a good testosterone level in the blood for a woman? 20 to 30. I have talked to my athletic trainer. It depends on your age though, Emma. It depends on your age. If it's cycling female, 20 to 30. I have talked to my athletic trainer and he said I can probably get a better brace. Heck yeah. And go to a PT, definitely. Great options to do. Even shockwave therapy, great thing you could do on the knee topically. And I bet there's multiple physical therapy clinics out there doing that. If not, there's some chiropractic clinics doing that too. So look out for shockwave therapy. Dumb question. How do we study with depression? I have horrible neck pain and back pain and cognition. Check your vitamin D levels, especially nowadays with seasonal things that occur. The fatty acids too, so maybe doing something like a Pro Omega, definitely something fantastic you could do. Oh, we got a hater in the comments already. I'm just gonna skip some of these freaking losers here. Half of them are bots anyways. Freaking, I'd rather help you guys than deal with dumbasses on here. Don't care today to do it. Usually I do dive into the haters, but don't care today. The horrible neck pain thing, kind of what I was talking about earlier. You can get a Denerol since you're doing a lot of studying. You're basically head down all the time, which is just straightening the heck out of your neck, and it needs to be like this, not like this. So we want less banana on one end. You gotta flip that banana around. To do that, you have to get the ligaments nice and elastic and start to push forward, and you have to retrain things muscular-wise. So you could do a prolordotic band that you could find on Amazon or something like that, just to help promote that cervical curve, strengthening the anterior postural muscles there. Some Brugger's resets, great thing to be doing, but your vitamin D, the omegas on top of that, and probably something like Bacopa just to calm things down, but send me a message, I'll direct you on where to get those things. Have you dealt with anti-cardiolipin disease? I'm really suffering. I mean, anything that you go through chronically is going to be a loss of function from stressors added up over time. So definitely medically, I know for one, you have that diagnosis category. So you've already seen specialists, which is freaking awesome. They know the situation, you can communicate that well, which is great. And now it's how do we rebuild the house instead of what do we use to spray the fire? Because medicine does a really good job of putting fires out. I want to be the guy that rebuilds the house. So we got to figure out inflammatory wise where things are coming from. And there's definitely a lot of things that go on chemically, like for cardiac things in general, K2, potassium, way overlooked. And that's a lot to do with blood pressure and clotting, that those two things are amazing helping out with. Neo 40, another great one. But I'd be curious as to what's going on with the immune system, because the GI and all these other factors do have an effect on that. The same way if you smash your big toe, your heart rate's going to change, blood pressure's going to change, stress hormones change, even your mood changes. So you got to figure out where those stressors are occurring and I would want to do some additional labs on you or see all the tests that you've gotten done already. But your body's meant to heal itself, so to provide just a nice sense of hope here, that is something that you do need to understand, that you've lost function somewhere, and as long as you can get those stressors off the system, now the body can start to do actual healing. So, but great question, and definitely send me a message on that one. Emma, I'm 28 and my testosterone levels are 29, which is good now. Used to be 50 to 60 when I was 40 pounds heavier because insulin. Emma, fantastic job. That is freaking awesome. I'm super glad to hear that. Because insulin's going to have a huge effect on that, and especially when you're, having some belly fat there, that's going to have visceral fat on the liver and create a whole cascade that happens with insulin and insulin-like growth factors too, which isn't just growth for muscles and things, but it's growth for any tissue. So you're seeing that good change by getting sugars down and doing some good things. So I love that. Okay. Can you tell an antifungal for scalp infection, please, with doesn't have azoles in it? I have seborrheic dermatitis. So that's going to be an issue with the immune system again, because the immune system is a primary system, guys, along with the nervous system. So those two have a massive impact on the rest of them. And they control the others too, and how they function. So typically, allergic responses to food is a common one I'm seeing with disruption to the GI whenever you're having scalp and hair and skin types of issues there. You can do something like an onion-based shampoo from Van Man, really good company, but there's not a magic natural thing that is going to have you take it and cure everything. That doesn't work. So, but yeah, I think I put my email in there, so send me an email, and we're probably gonna have to run some labs on your gut there. What country did you go to med school in? No med school. This is all natural health here. Chiropractor, background in all things holistic with herbal medicine and just understanding normal physiology. So looking for function here, not disease. Because your body heals that when you get function back. Anyways, it's because I'm using a sleeve for practice and a brace that is not sticking anymore. Yeah, the Velcro or something's starting to slip on you. I'm 22, pregnant with placenta previa. You have any advice about this? I would want to see where the labs are at, to be quite honest with you. There's, some anti-inflammatory things that you could do, turmeric, albizia, but I would want to know more about what labs are saying, because that's going to help guide us here instead of guessing with your health. Can you cure deafness like BJ? Oh, man. We got crazies in the chat here. All these bots, man. All these bots. It's crazy, because all these bots comment on my videos, and then I respond to them, and they don't say anything. It's like, what the hell? Do you test for mold? Yep. My daughter's dorm has black mold. Oh, my goodness. Yes, I mean, you want to get a urine mycotoxin test and probably start doing some colloidal silver nasal spray right now, just to protect the sinuses from breathing that in. Have at least some of a, antifungal bacterial barrier there. But aside from that, send me a message on here. We can get her a good quality mold test and figure out what we need to do here. Because the type of mold is going to depend on what we do. So, okay. Do you get confused for an MD? Sometimes. I put it in the name there, so. Emma, with those old T levels I had, would you suspect PCOS if the patient also had acne? Totally. Emma, yes, you are the poster child for that. Normal cycle, though very consistent. Okay, that's good. Your cycle doesn't have to be off necessarily to have something like PCOS developing underneath. And your body creates disease because of the environment currently taking place. So when you start to lose some of the function, now your body's going to have to create some compensation to it. So, great question though, Emma, and you're freaking kicking butt here. Getting that body back to normal. Do you think that's safe having people confuse you with someone who went to med school? It's in my name. I mean, I don't know how much more of a disclosure you could get from that, and also having not medical advice in the subject line of my bio. So, do you think you can reverse PCOS because I lost weight, no insulin resistance, but I still get hair things going on? Growth slightly on the jawline. So, there can be some hormone left over that needs to convert down in the form of DHT. So I know you had testosterone looked at. I would just get another blood lab. A Dutch test is also fantastic at looking at the adrenals too, because a lot of stress does affect that a ton. It's not just the sugar story. And honestly, again, back to the nervous system, back to the immune system, those are primary, and it's the issues with those two systems that create hormone problems in the first place. So yes, I would look into DHT, and then probably something like a food allergy test as well, just so that you can get, okay, I have autoimmunity. There we go, Emma. We got to either fix the GI, look at things for mold, look at things for bacteria, fungus, but it all depends. And history of what was done medically too. Hey, psoriasis, eczema, okay. And my person gave me a food allergy test and a GI test. Beautiful. Emma, you're kicking butt. Does autoimmunity cause PCOS? Well, the immune system is going to be going crazy, so it's going to be pretty much attacking everything, and then when you get that slight bit of insulin picking up, now you're going to grow cysts like it's nobody's business. So it's definitely tied into that, and that's probably the baseline reason for that, aside from the insulin factor. So totally. Okay, so some blood work is required. Can we cure ED? That word cure doesn't really make sense because there's no cures for anything, by the way. I don't know if you guys knew that, but yeah, when you go to doctors, you get an opinion, first of all, and then they try different things, and some things work, some things fail, because when you're throwing darts on a dartboard without having labs done and knowing what you're doing and why, then that starts to happen. But when you're having something like ED, there's immune factors that are taking place, preventing you from creating hormone. So your body's going to prioritize survival over testosterone levels. It could give two craps about testosterone if your whole system is being attacked by something. And this is not like to fear bugs or anything. It's just getting inflammation down, getting stressors down, mentally, chemically, physically, and then you start to get that function back in those different systems. But you can do, some things for nutrient deficiencies, like a glandular of some kind, to where you can have bull testicle in there, heart, liver, and just good organ meat capsules that will cover a lot of these deficiencies. Zinc is also really common deficient. And make sure you're getting good sleep in there too. But aside from that, resistance training. Yeah, it's true. Nobody's... That's really funny. For those of you on TikTok, you can't get to see the jokes that come up through YouTube. YouTube is way funnier, by the way. So, if any of you funny in TikTok, let's hear it. Okay, Tears to Healing. I don't drink at all. My ALT came back at 62. Dang. My doc told me to stop Tylenol. Any other... And then it cut off there. Yeah, that's going up because of some inflammatory source or some issue with blood sugar, which again comes back to creating an inflammatory response, having too much sugars. So I would cut your sugars down like crazy. Do something like dandelion root and turmeric. Those pair really well. And I don't know if you're a guy or a girl because the screen name doesn't really tell me, but yeah, cut sugars. get some turmeric, some dandelion root, and I would want to talk to you, figure out a couple more things that are going on, because very little details there, but how you're feeling and things, because there can be gallbladder connections as well. No hormone test though. Emma, that's okay though. Sorry if this is TMI, but I noticed with Vitex, my libido dropped. Is that normal? Same with spearmint. So no hormone test though, because in the beginning you should be going after the immune factors and things. If you really want to see hormones, you can. It's just that work is going to come later anyways. So I'm actually glad that they did that, because they're saying, hey, I know you want to see hormones, but this is how we fix them. So that's a good path to be on. And then with the Vitex, yeah, it's not going to raise your sex drive, that's for sure, because you're going to be working on just getting the corpus luteum develop and signaling from the brain down to that corpus luteum so that you can create more progesterone and just get more function out of that. So that should be done in more the second half of the cycle, not really out throughout the whole thing. But that's probably why you're seeing that drop. And you're used to testosterone at 50, 60. So your sex drive then is way different than it's going to be normally. You're going to be a different woman every week of the month. So, and that's a good thing. It's not bagging on women there. Should I take TRT to boost my testosterone? I'm 19. By the way, Doc, where are you from? I don't recommend things medically, so gonna have to go to somebody different from what I do. This is all natural stuff here. Getting your body to produce normal amounts on its own. So I have 60-year-olds with testosterone in the 900s because that's normal. It's not supposed to go down with age. That's total BS. So you can get back to normal. We just got to rebuild the house. And I'm from New Jersey, actually. Do not take tests. You will destroy your life. Hey, take it from this guy. I didn't say that. I was reading his comment. Anyways, opinions on the SSRIs. You guys are making this tough. What could I say here? I'll leave it there. There's a lot that goes on with that. If you need that, you should definitely ask somebody from the medical world, because you may need that right now. I'm more of somebody that can help you rebuild the body and not need that stuff anymore once you've figured out why that's happening. But if that's needed currently right now, totally, I would definitely want you to check out something like California Poppy, something like Bacopa, if you're willing to do some more conservative routes. But if you need something because of your own safety or something like that, please go seek it. That's what medicine's there for. Is minoxidil pill better than minoxidil topical? I have the pill, but debating to take it or not. I don't know. I don't give out meds. I do not give out medications, people. So, just to let you know. Spiral, how do we heal PTSD from watching animals be murdered? Oh my goodness. I'm ruined. That sounds like you may have to talk to somebody about that. The stressor-wise, California Poppy, fantastic. You could kind of get some of that immediate acute stress off, but that you definitely want to talk to somebody through those things. I am not qualified to do so, though. By the way, I have some mental health issues, too. My doctor recommended fluoxetine, etazolam, and olezopam. Wow. Are these safe to use? I would check those out on your own. Again, don't give out meds. I don't give out advice on these things. All natural health stuff. So ask an MD. And you could look those things up yourself on Hippocrates on drugs.com. It'll tell you everything that it does, what the side effects are, or the negative side effects are. I just bombed my physics exam. How over is it for me? I mean, it's physics. Give yourself a break, right? Thanks, Doc, for telling. Hey, do what I can, huh? She told me turmeric was raising my levels. No. It should be in liquid form. Some people think that powderized turmeric is, the way to go in terms of supplementation. It's not water soluble. It needs an alcohol extraction, and needs to be organic, and all those things have to be done correctly. You need clinical grade liquid turmeric. So send me a message. I'll direct you on where to get those things from clean brands. But turmeric is a liver coolant, so that makes no sense at all. When you look at the herb category, when you look at the mechanisms of action, it does not raise enzyme levels. Food does not do that. So, greetings from Japan. Oh my goodness. Thanks for the help. Not sorry. 30-year-old female, and right before this, I had major joint pain in my hands and my feet. Okay, we got to look for the immune system reactants there, because what you say before, liver at 62, so there's probably some background autoimmune reaction that happen. I tested negative for autoimmune, okay, and inflammation lab came back low at 2. Do you mean CRP? There's other ways to look for inflammatory stressors too. I think deficiencies of fatty acids is a very common reason why women hit that issue. Plus you're 38, so that perimenopausal story is coming to fruition at this point, and the liver does a lot of hormonal conversion as well. So maybe this is a hormone piece that's going on here, because your estrogens have a lot to do with bone metabolism and affect your joint tissues a lot. I'd be curious where lymphocytes are at, because it's common for different viruses and things to come out through things with the joint tissue. So, but if it's not that, then we have to go and look into more bacterial things and fungal, and you can find the answer why. It's just, we got to do a little search party and figure this out why. My doc recommended progesterone for insomnia. That could actually help. Progesterone is very calming, very calming. And just tears to healing. If your progesterone's low, guess what? You're going to have issues with mental health, with joints, and all these different things. So could that be a reason for the liver enzymes to be up? No, but there's some functionality occurring there as well that's being lost. If you have that lab work though, send me a message. I'll give you my email, and then I can direct you on what I would do with those labs if I were you. So maybe you have enough testing already. Let's take a look though. I know exactly what you faced in life. You still have pride despite your hardships. Don't let pride destroy who you are. Oh, I think they're talking back and forth. That's funny though. Should I get a, oh my goodness, 2 to 3 millimeter brain aneurysm clamped? My goodness, go and see a medical provider. That is not a question for me, my friend. Definitely not. You should go and ask somebody who does that surgery. Libido good during ovulation, which is when it really, when it should only be kind of in that little window there. But with those SUPs, it dropped at different times. Will maca cause hair growth or PCOS symptoms? It's more modulation, so I don't think you have a lack of hormone though. It's probably more of a conversion thing going on. I would add in reishi mushroom, because there's probably some DHT built up. Although your testosterone's looking good, just do some reishi in there. For Emma, what do you think is the best knee brace if you think you have a meniscus tear? It's going to depend on where you have that meniscus tear, whether it's inside the knee or on the outside. But there's probably more specialized braces coming out right now that are fantastic for an issue like that. I haven't looked at the market in a minute, but there's probably some good ones out there. Libido wasn't that good at 50 to 60. Honestly, libido increases with inositol and dropped, but it dropped with Vitex big time and always drops when progesterone rises. I don't know what to do. I thought maca might be caused. Emma, that's just normal. It's not it's not normal to have a high sex drive 4 weeks out of the month for a cycling female. That's not normal at all. You're gonna have problems. You're gonna have problems with your body there. So you should really crave sex during ovulation and really maybe a little bit of week 2, but that's really it. So you want more of, week 1, want to punch your man in the nose. Week 2, that's kind of when we're feeling fun. Week 3, companionship. Week 4, you start nesting and basically preparing for a pregnancy that wasn't fertilized. So that is normal, my friend. And yeah, the hirsutism or the hair growth there's probably some immune factor or that DHT is still built up. Yes, perimenopause sounds so right. Then yeah, okay, 0.6, very good. Ooh, lymphocytes, very low. Okay, well that could be why there can be some things attacking the joints there in terms of some viral issues, which is common, especially during these months and things. But there's probably that immune factor along with some things hormonally. I would love you doing some reishi, some turkey tail in there, some black cohosh, maybe for a little bit right now, and chase tree or Vitex, as Emma said, but chase tree is what the wellness source is called. But send me a message. I want to see those labs. I want my eyes to look over those myself, because with lymphocytes there's percentages and there's absolute counts, so I want to make sure, and I'll direct you on what to be doing. Do you think you can explain why someone can get panic attacks a lot? I see a lot of issues with nervous system stressors like social media, phone use, lack of sleep, things that go on there. There's also a lot of hormonal reasons too for mental health things, and adrenals too, honestly. Because for women, you could be eating right, getting adjusted, using vibration plates, going on inversion tables, getting massages, doing all this stuff. But if you're having mental stressors occur over and over, whether it's your work or a relationship or kids or whatever, we have to rebuild the adrenals, because those become deficient, and that's going to throw neurotransmitters off too. You'll be very excitatory and have basically excess adrenaline be pumped through the system, and then be fatigued and flip-flop between feeling crazy and then not motivated and sad and fatigued and all that. So it's not fun. But you would want to do something like a Dutch test for AMNA, and probably doing some California poppy right now in good amounts. But send me a message, I'll tell you what to do. Got you a bit there. Oh my goodness, Dr. Antonio, when will the stars align? Oh, with the the phone call. I know. Is tomorrow Thursday? I think tomorrow's Thursday. Maybe tomorrow. Who knows? And for you guys on here, I am now doing virtual or remote visits. So for those of you guys that want to get on the phone, just email me. Thank you very much. We'll definitely get that settled in and hooked up there. So you're very funny though. You're the number one priority. So are you. So are you. All right. Rich, genuine question. How much of this do you learn in Chiro School, or is it more self-teaching? The framework of thinking is definitely from schooling, but it is very medically heavy within grad school, even with Chiro. Because you get, some basic lab training, you get a lot of the anatomy, the physiology, neurology, all these different things. A little bit on pharmacology, very little, but a lot of the herbal knowledge and things is really talking with more experienced docs and reading a ton of books and a ton of PubMed research on a lot of these things too. That's why I even know these things about a lot of the herbs. So it does depend on their mechanisms of actions and what's going on with the person, but that philosophy of, okay, how we start our thinking is the body doesn't make mistakes, and there's an inflammatory reason or a neurological reason why people are sick, and that creates deficiencies, toxicities, inflammatory responses, which throws off the entire system, and your body's just left trying to adapt to these things. And the more stressors that end up, the less you can adapt, and now you get sick, your joints hurt, your muscles hurt, bowels are off, mental health issues, hormonally. So That a lot of that came from post-grad knowledge and things. Pro Light. I'm having them right now. Can't sleep for a couple of nights. For panic attacks, guys, California Poppy, guys. Yeah, let me put you on to something. California Poppy. Enough said. Some people like Kava a little bit more, but just for most women out there, it's the two top things I give out: Albizia and California Poppy. So, you know, if you're thinking about doing something, just do those two and you'll see the difference. I'm in perimenopause. I haven't had a period in 10 months. Now I have light bleeding. Is that normal? I would want to know your age, because if you're getting, closer to 53, that can be happening, but you could do a pituitary panel and just make sure, because depending on the age and things, it may be time. But most of the time, though, with infertility stories, perimenopause, stresses that add up, if you have children, if you have a full-time job, if you have a relationship, you're going to have stress issues, and this is different for men and women, because we all have the same hormones, which is kind of crazy. But they don't behave the same, and they're in different amounts. So, like for a guy, a normal testosterone level's 7, 8, 900. For a female, it's like 20 to 30. For a menopausal female, it should be a little bit higher than that, because you're relying more on the adrenals now that the ovaries are on vacation. But the adrenals, the ovaries, and fat tissue create hormones. So if you're seeing a rapid or a steady increase of fat tissue, because your ovaries are losing some functionality there, maybe it's a communication with the brain and the pituitary gland to the ovaries to create these hormones. There can be deficiencies from food and things like that too, inflammatory means, but fat tissue is going to be responsible for creating estrogens. So if you're constantly stressing out, for the ladies in the chats, you're going to gain weight, and it's not fun because no woman wants to gain weight. Doesn't matter what your age is, it's the same story that occurs. It's the only 3 ways you can make female hormone or estrogens. We all have the same hormones, males, females, same thing. But yes, I would want to do a Dutch test and some blood work on you and see where those hormones are at and what we got to do, because your labs will directly tell us what foods you should be consuming, what to do for the immune factors, how to take your body physically, what you should be doing activity-wise, when you should be working out, what specific workouts should you be doing, and how not to excite that system, which can be really common for people too. I think that's more attributed by the lack of eating, not eating enough, for one thing. But yeah, send me a message. Let's get some testing done on you. Pro Light, after IUD removal, I have lots of panic attacks and burning skin everywhere. I don't know what to do. I would want you to start doing some Albizia and some Chase Tree, because when your progesterone's too low, because you've been getting that from an IUD, the artificial hormone thing, now your immune system's going to go crazy. So Albizia being the best anti-inflammatory thing that you could do, progesterone having a very good dampening effect on excitatory immune factors, and will also impact your dopamine and a lot of the neurotransmitters there too, and make you feel nice and happy. But I would say, start with those two, and then probably in 3 months you would want to get hormones run in the blood. And I would want to talk to you in between there to see how things mental stress-wise is going, because it sounds like you're, going through it. Maybe even adding Albizia, California Poppy, and Chase Tree to that mix. But yes. Mercy. Good evening, everyone. Hey, how you doing? Dang, I just registered that our hormones don't work the same. Such a simple yet insightful truth. Oh, heck yeah. I have a benign tumor on my pituitary. Is that messing with my hormones as well? It can. It can put pressure on things neurologically and mess with some signaling factors, but you can have some of those benign things, those benign growths, to shrink back down. Even people with, the fatty deposits, what the heck are they called? Lipomas and things, or benign tumors and stuff. when you get inflammatory stress down, all those excess growth tissues start to shrink. So I'm glad you got that checked out, though, just to make sure that it is benign. But I would want to run some labs on you and see what your brain is telling your body, and what we have to do to just support the normal function there. I was going to say stress doesn't have me eat. Yes, stress will suppress your appetite, and then after you've stressed yourself out, then you're going to crave a bunch of sweets. And just to let you in on a little secret, stressed, spelled backwards, is desserts. So there you go. That's why that happens, because you don't crave a salad when you're stressed out. So yes, I get, oh crap. I get acne in the lower part of my face, but functional doc said no PCOS per labs anymore. Thank you. Appreciate you answering. Yes. I would wonder if DHT was run on there, Emma. I'd be very curious. Larry, after having a bad panic attack, a lot of panic attacks. What the heck? After having a bad panic attack, can the symptoms last for days? They can. If you're still in that sense of fight or flight and you're not eating enough and you're feeling those emotions pretty heavily, it's your body trying to adapt to what's going on. I would be very curious about your gut health, because your neurotransmitters, the majority of them, at least 80-90% of them, are made in the GI. So anything mental health wise, it's get the brain to calm down, get some stress off the adrenal response as we figure out the inflammatory testing on the GI. So I would want to run probably food and stool on you, my friend. Okay, I saw a good, I'm going to skip to Emma's. What do you do for DHT? Again, you figure out the inflammatory piece of why that's happening. Typically, again, mental stress is going to be a huge portion of why that conversion slows down, because you're supposed to just normally convert those things. I would wonder if you've gone through any detox yet, just to help your liver, because that's primarily what's converting that hormone down and through into the estrogens. So it's not a this for that approach, although functional medicine does teach you to think that way, or regular medicine. I'm trying to break people away from that frame of thinking for this for that. I see a lab supplement to take. ChatGPT could tell you what to do with that. That's not how your body's doing things. Your body's creating a response, and that's being seen on labs, and then you have to figure out why the body's compensating in that way and plan your attack in that direction, not the other way around to lab that's off. Okay, this article showed DHT conversion, great. You're going to take a bunch of saw palmetto until when? Until that conversion gets better, and then you run it a year later and it's back to the same level. I don't think that's a good financial way to go about it. But once you clear out the GI, I would want you to do a detox and then get more into helping the liver convert things through. How long have we been? 45 minutes already. Holy crap. I was going to say stress. Okay, we said that. I've gained weight rapidly and can't lose weight even while taking Mounjaro. Interesting. You can do... Actually, I would want to talk to you first, because I would want to see why you can't lose weight. Not what do you take to lose weight. So there's a reason why. And there's probably several. That we got to find those reasons. But send me an email and we can figure that out. Your body's not meant to feel that way and pack on tons of weight and not be able to get it off. Hey, Dr. Antonio, as men, I really learned something self-reflected today. When a couple argues, it's always two people's fault, the woman and her stupid-ass girlfriend who gives her advice. Holy crap. This is why I love the YouTube comments. Oh my goodness. Alex, Thank you for that. Thank you. Do that every time we go live. Just put a little joke in there. I will respond to it. When people piss you off, doesn't matter who it is, relationship, friendship, whatever it is, what's pissing you off is something inside that person that is something you don't like about yourself. So there's something in that person that is coming out during that argument that hits the reflection point inside you and makes you go crazy because you can't stand that about yourself and you're seeing it come to life in reality and you want to tear their head off or punch them in the nose. But yeah, and we're all connected to some level, so the framework to start to work out of that stuff is, you're kind of a part of everybody. We're all human beings at this point, right? Why don't we kind of take that collective mindset through it? But anyways, cool train of thought, very funny. Thank you very much for that. Larry, we hit his private dancer. What the heck? Rashmi Paka. The body does make mistakes. Cancer, type 1 diabetes, ... The body creates that response for cancer. The body literally takes all the unhealthy cells and puts them into one clump called a tumor so that the immune system can attack it. That is not stupid. That is not a mistake. There's reasons why you got that cancer. And we can get into it. I would just go to thewellnessway.com, check out the vaccine database that we were building out, and do some good reading there. But yeah, your body's creating that response to get you back to normal. Or trying to get the immune system to attack those cells. Pretty crazy. Pretty crazy. My doctor is frustrating me. I need to know why my lower back hurts so bad to my calves. So there's probably some nerve irritation going on there. If not, I would want to look at your blood sugar levels, because that can certainly be, a reason for that nerve travel and pain. That would be more, burning and really in the feet, in certain parts of the foot, but there's probably some nerve irritation going on. You can definitely get an inversion table for being at home. Get your massages in, go to a chiropractor, start training some abdominal strength there in terms of obliques and stability muscles, because the low back has a huge influence on that. And your glutes, baby. Get your glutes nice and strong, along with the low back muscles there too. Hip extensions, really light deadlifts and things. But if you haven't had an x-ray done or, some type of imaging, that's worth doing. Aggie says hello. Hello, people. When you said week 2 libido can elevate, is that your period? No. Day 1 of the period is the first spot of blood that you see. So if you don't have an Oura ring already, Emma, and for any cycling woman on here, I would want you to get an Oura ring. Or even if you're not cycling, it could just show where stress is at throughout the day, but it's going to measure your body temperature and tell you exactly when ovulation is taking place every month, along with period cycles and all that stuff. But day 1 is the first spot of blood, and week 2 is 13 days later. So 13 to 15 days, which is when you're most fertile, which is when you're going to have the most sex drive. Just good normal physiology there, programmed into your DNA. Okay, I sent you a message. Beautiful. Advice for people with family of heart history. I would want you to get a calcium score done. It's $100. Go to a hospital, literally pay cash for a calcium score just to have some good understanding of where things are at. It'll look at the major vessels of the heart, see what the calcification is like within those major vessels, seeing if any of them are, becoming closed off and things. And vitamin D, really good thing to be checking, because along with that vitamin D, which you do want 60, 70, 80 at those levels, is going to typically be paired with a K2 vitamin, which you definitely should have, because that's going to have a huge factor of directing that calcium throughout the body. Also potassium. Holy freaking goodness. Sodium potassium pumps control calcium exchange in the body. So if you are deficient in sodium and potassium, which so many people are, guys, normal potassium levels are like 4,400 to 4,700 milligrams a day, depending on if you're a guy or girl. And salt is almost 5 grams a day. And that cellular fluid exchange controls calcium exchange too. So it's not just K2, but you could do some of that as well. And also your fermented foods. And if there is some, issues going on with sugars, blood sugars are going to heavily have oxidative effects on the body. I would look at homocysteine. I would look at your blood sugars. And if those are off, we got to look into the GI as well. So start with the calcium score, get some blood work done. If you don't know where to get that testing from, we have mail panels that I could literally send you and you'll be good. Okay, Stefan, good question though. Just did lab work, checked my AAMH, and it was 1.53. Thoughts on that from a fertility standpoint? So I want to see that marker along with the other female-based hormones too. But standalone, it's not too shabby, just seeing that there. But it's hard to just go off one marker, especially for fertility. And 40% of the time, it's female. 40% of the time, it's male. 20% of the time, it's both male and female couples. So whether you're going through IVF and getting tested with those things, I would just be curious as to what the path is right now and what the game plan is to get hormonal levels high enough so that you can maintain that pregnancy. Emma, oh shoot. Wait, why did I gain weight like crazy when I got off the Ozempic? I didn't change my diet. Because you were on something that suppressed certain pathways, and then those pathways went back to normal because it didn't fix the underlying problem with insulin and why you were holding on to weight in the first place. So it just manipulated the body there. Best way to cure gastritis and GERD, it's going to be, doing something like a food allergy test paired with some aloe vera juice that you should be doing in the beginning, along with some zinc from oyster meat. I know that's like super specific, but you do need to get it from there just to have all the right constituents in the correct amounts. And then probably do some chamomile in there so that you have aloe vera juice, you have some zinc, you have chamomile in there. You can get good mucosal membrane lining created just to help calm some of that irritation down. But gastritis, so inflammation of the stomach, oh man, we have an angry nurse in the chat. Hey, I'll get to it in a minute. But yeah, and I'd be curious to what labs are looking like. Have you talked to anybody about this? For Nikki here, if you've seen providers already and they've looked for pathology and there's been no pathology, that is a good thing. But we still need to look for where function was lost and where those inflammatory stressors are coming from, which even mental stress will suppress and mess with the pH of the stomach. Oh my goodness, now you can't break down food. Now that food doesn't make its way through that digestive system as quickly, it doesn't break down as much, it doesn't prepare the gallbladder and the small intestine to secrete the digestive enzymes that come from that good stomach acid being suppressed by the mental stress issues. And now if you have inflammatory stresses on top of that, oh my goodness. So yeah, we gotta look at food allergies, but start with those 3 and you can start there. Okay, have a mild headache and low energy, no other symptoms for 1 year straight. I've tried electrolytes. I would look for things chemically and physically in here, because if electrolytes are doing well, that is a good thing. But we do need to look at things postural-wise, because that can mess with a lot of the blood flow to the head, the nervous system there, create additional stress on the body, create back pain and all these sorts of issues. Hold on, I gotta do a stupid verification. Okay. I'm glad you tried the electrolytes. But we probably have to look into food and what you're consuming, because if it's not something postural, which it very probably half the darn reason for it is probably postural for these headaches, but there can be chemical reasons too. So okay, the libido for me is high around that time of the month too, and ovulation, but not high other times. Okay, so Emma, did you mean, what part of the cycle did you mean? Like during the period or during the end? For that extra libido week. Just let me know there. I got kind of confused. Okay, let's talk. I'm suffering PTSD. Oh my goodness. Can't get over it. Bet you passed by. Okay, so some PTSD things going on. You definitely want to talk to somebody about this, but for helping your body adapt to that mental stress, some California poppy, and probably either ashwagandha or kava to pair with that. But I would want to know a little bit more about you, and you're probably going to want to talk through this issue with somebody that, you know, talks about these things. But I'm sorry to hear that. Will a SIBO breath test check for those things? No. I know, I wish it could, because it's very easy to do, and you probably don't want to poop in a box. But for Nikki, you could probably start with just do a food allergy test first. Let's just start there, because that's going to show what proteins you're not breaking down, which will show us which organ's being stressed the most. And I can guarantee you that it's going to be mainly fatty-based things, like just fatty or rich foods and protein-rich foods that are going to show up on that test, which just further solidifies, one, what we can do to help the body start to calm things down and rebuild, but then what you should be avoiding, and then when to redo that test and all those things. But Nikki sent me a message. My period and ovulation. That's what I thought you meant. Libido elevates before the period and during. And is it connected to the hair growth? It could be. I would wonder, what does your temper look like? Is your temper like real snippy? I'd be curious there, because then that would show me more of the DHT factor. But it's not uncommon for women to have more of a sex drive or libido during a period week. That's not unheard of. Do you miss Mike Litterus? I don't know who the hell that is. Can mycotoxins only cause neurological issues without physical symptoms in some people? Yeah, if you mean like your eyes and sensory type issues or twitching or something like that, totally. And it's going to be suppressing the immune system and messing with things neurologically too, especially depending on the type of mold, because some of them target different things, whether it's ochratoxin, mycophenolic acid, and all the other ones with that too. So I've seen some crazy high tests. I actually had one lady that was a hairdresser, and her joints in her hands, and you would think, okay, hairdresser, common to have some wrist pain and finger pains and things like that, but hers was getting real aggressive, and she's like, my hands look like a 90-year-old woman. Like, no kidding. She sent me pictures. She's like, I am so embarrassed of this. Hands cracking, joints hurt like crazy. So, you know, originally ran blood work and things, hormonally deficient, which is like, okay, let's get stress down. Let's get the adrenals back online, start bringing inflammation down and things. And hormonally, mental stress-wise, a lot of things got better. But on the next CBC that we ran, her immune cells were still very low. And I was like, what the heck's going on here? Because we looked into the GI and all these things beforehand. So I was like, okay, is there any mold in the hair salon that you work at? And she's like, yeah, all over the basement, like covered in black mold, and my boss puts bleach on it. like once a week, and I'm like, oh my god, that's the worst thing to do, because you put bleach on that mold and it's just gonna freaking fly all into your air and you can breathe it all in. So her test was off the charts. I wish that I could like easily switch green, like the green screen background stuff. I don't know why I'm snapping at you people, but I'm probably gonna wrap things up here in a minute. I gotta do a whole bunch of stuff for the office soon here, but pretty cool. And yes, I can be a little moody, but I'm more emotional than anything around that time. Okay. And again, okay. I would say you could probably do a heavy amount of reishi mushroom, because that'll help with immune factors, the hypothalamus, some of those stress and mood swing things going on there, and the DHT piece, which I don't know if I mentioned that, but it will help convert some of that DHT down. But reishi mushroom, any mushroom, guys, medicinal mushrooms are my favorite freaking thing on the planet, aside from glandulars. Then it's liquid herbs, which is kind of crazy because usually I'm talking your ears off about liquid herbs most of the time. Oh, Shirley, what's going on? Popping on the YouTube. How we doing? Mold starting to cause POTS symptoms for me. It definitely can. That's most POTS people, vaccine issues or mold. That's literally what I see time and time again. But there's different types of POTS, so it's not that cut and dry. But obviously, you know the basics with the electrolytes and the compression sleeves and all those things. I think an inversion table is really valuable. Potassium, please, needs to really be focused on and taken way more than you're thinking. But look up the RDAs, look up how much you're getting through your food, and that will help a lot with your adaptability for those POTS issues, with the heart rate and things, and controlling blood pressure and stuff. And I would say, I don't know, maybe something like ashwagandha, just a nice safe adaptogen there, because you do want to help the adrenals out too. They have huge influence on postural things and blood pressure. Oh my goodness, your kidneys. They're what's filtering out those mycotoxins. So freaking brain blast at the last inning here. Yeah, I would want you doing potassium. I would want you doing an adaptogen for the adrenals, and then supporting our kidneys a ton. So probably some Albizia in there, and something like dandelion root. So a good little quattro thing to be pairing with, and I would get that mold test done so that we know what type of mold it is and how we get it out of the body, and rebuild you back, and you won't have all these issues, people. Okay, thanks for hanging out. That was fun. For you guys on here, I'm now doing remote visits again, so we are back online, running before we get everything set up in person wise for the Wellness Way Randolph coming to you soon. I still gotta do a bunch of administration and back end stuff right after this, so it's the only reason I'm ending the live. Otherwise we go for 6 hours straight. But anyways, yeah, that was good. Get outside, get to sleep, eat your food, get your protein in, get your stress down, go to Cairo. Yeah, stay healthy, stay free. Thanks for hanging out, as always, and I will see you guys back tomorrow. I'm going to try and be more consistent with the time here. See ya, Shirley. Adios, guys. But yes, that's pretty much it. So see you guys tomorrow.